There's a drug that is given to sickle cell patients which can actually shut down the bone marrow if it's not carefully dosed. Hydroxyurea increases fetal hemoglobin, which prevents red blood cell distortion, but it also blocks ribonucleotide reductase and that halts DNA synthesis. This will slow down the cell division, leading to macrocytosis and pancytopenia. So, when a sickle cell patient shows up with fatigue and a sky high MCV and a shockingly low reticulocyte count, then you should think of marrow suppression, right? Because pancytopenia is a reduction in the number of red blood cells and white blood cells and platelets in the blood. So hydroxyurea does help sickle cell patients by increasing the HbF, but causes dose-dependent bone marrow suppression, causing macrocytosis and pancytopenia. So 12-year-old girl with HBSS presents with fatigue and pallor. She takes these medications, folic acid, hydroxyurea, and here are her blood counts. So autoantibody inhibition of purine, bone marrow, or DNA synthesis inhibition. Okay, so it's going to be DNA synthesis inhibition from a pharmacologic agent. And the explanation is hydroxyurea inhibits the ribonucleotide reductase. This causes less deoxynucleotides, and therefore you can't do DNA synthesis. And then you have macrocytic anemia and marrow suppression and pancytopenia. So some other answer choices might be tempting. Autoimmune hemolysis, that would not be consistent with a low retic count. There's no evidence for hemolysis in our labs here. And we look at our hemoglobin at 6.2. Low hemoglobin would tell you they're anemia, so it's like sickle cell, is what it tells you. Mean corpuscle volume at higher than, slightly elevated 115. That's high. So it's a corpuscular volume. It's macrocytic. So it might be like a folate deficiency, you'd think. Reticulocyte count's super low. So with a low retic count of 0.4, you'd say, okay, that's not hemolysis. It's going to be bone marrow suppression because bone marrow response, that's how you make it. So the bone marrow is not working. The platelets, thrombocytopenia, that'd be like bone marrow involvement. And your leukocytes, that'd be bone marrow suppression. Okay, so there we go. That's kind of the gist of what's happening here. Basically, sickle cell pancytopenia, that's a decrease in all three blood lineages. And pancytopenia caused by the hemopoietic stem cell dysfunction, bone marrow infiltration, and also peripheral destruction of mature blood counts. So low retic, if it's super, super low, that means the bone marrow is impaired. And macrocytosis should then make us think of different things like B12, folate, or medication, hydroxyurea, and that's indeed what it is, because there's no evidence of the first two. So it has to be hydroxyurea impairing the DNA synthesis in hematopoietic cells. So yeah, it inhibits the ribonucleoside reductase, and that's what generates the deoxyribonucleoside triphosphates for DNA synthesis repair. So if you don't have that, because hydroxyurea is cutting it out, then we're going to have slow erythrocyte nuclear development, and that's going to cause decreased cellular division with an increased red blood cell size. And so you got to have high doses of hydroxyurea, the high doses of hydroxyurea will impair the nuclear involvement. So yeah, it's just a super disease-modifying medication that you really have to watch out for because HbF is, you want to increase that HbF, and when it functions normally, the erythrocytes with increased HbF are less likely to sickle, and that's why you want to have it there, but it can cause problems, so you have to be mindful of that. Yeah, so folate deficiency you could also think of, but they're taking folic acid, and a lot of these question stems. Yeah, see, she's taking folic acid, so it's not going to be that. Paroxysmal nocturnal hemoglobinuria. So that one is not going to be right because that's the complement system. It's not going to be relevant to sickle cell. And then we have the sequestration. So you could have like the peripheral sequestration due to splenic congestion. So that's not going to be indicated by the lab findings. There's no splenomegaly. And that'd be seen with the sequestration. So there's no evidence of that. And so it's going to be your medication-induced inhibition. And so, yeah, there we go. That's kind of the basis of this question. Hopefully this is helpful. Sickle cell anemia.